Welcome. In this video abstract, we will be discussing the first suspected case of sporadic Creutzfeldt-Jakob disease in Syria. Prion diseases are extremely rare fatal disorders where a misfolded prion protein destroys the brain. The most common form is called sporadic Creutzfeldt-Jakob disease, and globally it affects about 1.5 to 2 people in every million annually. But the critical issue is that a world map of this disease is full of blank spaces. Formal surveillance data for this disease exist for only 34 countries. For most of the world, especially in low and middle income regions, our understanding relies on scattered case reports and case series, meaning that the true global burden is largely unknown. The story begins with a 72-year-old woman who visited our hospital with non-specific complaints. These symptoms were mainly inattention, apathy, and depressive signs. Her symptoms of social withdrawal, abandoning hobbies, and personality changes spanned a few months before rapidly declining and being hospitalized due to complete and sudden loss of motor function. Shortly after, she was discharged in a state of minimal consciousness and received symptomatic treatment before dying due to complications. Diffusion-weighted magnetic resonance imaging revealed bright ribbon-like hyperintensities in the cortex and deep brain structures like the basal ganglia. This specific pattern is a key fingerprint for Creutzfeldt-Jakob disease that played a major part in the diagnostic process. So to put it all together, we have rapidly progressive dementia, specific neurological signs like myoclonus, pyramidal and extrapyramidal signs, and characteristic MRI findings. This combination is sufficient to establish a probable Creutzfeldt-Jakob disease diagnosis according to the CDC criteria. We have also carefully ruled out many diseases that can mimic Creutzfeldt-Jakob disease, from infections to autoimmune diseases and other types of dementia. So why is this case important? Well, this was the first ever case to be documented in Syria. With a global incidence of 1.5 to 2 per million, a country with over 20 million people would expect to see cases. The absence of prior reports highlights the critical surveillance gap we discussed and directly means that cases were likely missed. But why is it underdiagnosed in Syria and other developing regions? A lack of advanced diagnostic tests, long wait list for affordable neuroimaging, cultural considerations preventing histologic post-mortem confirmation, and the economic dilemma of investing limited resources into diagnostic and untreatable disease are all possible reasons. In conclusion, this case represents a powerful call to action. To close this global knowledge gap, we propose a three-part solution. First, raise awareness among physicians to consider Creutzfeldt-Jakob disease when they see rapid dementia. Second, establish national registries in more countries to track cases. And third, foster global collaborations to develop more accessible, cost-effective diagnostics. Thank you for listening.